Hi, my name is Kaylee Higginbotham, and I'm doing a presentation over HIV in Cuba for Dr. Thomas Manning's medicinal chemistry class. In this presentation, I will talk about a general overview of HIV, then its structure, treatment, modes of transmission, and symptoms. Then I will talk about Cuba and its government and healthcare against HIV. HIV stands for Human Immune Deficiency Virus, which is a virus that infects human beings that weakens their immune system by destroying important cells that fight disease and infections, which does not allow the immune system to protect you. Once someone is infected by HIV, they are unable to get rid of the virus like others. HIV hides in certain parts of your body, like your T cells and CD4 cells, which they multiply, then destroy the cells. After a long period of time, HIV will have destroyed many cells. This is when the body is unable to fight infections and diseases. This leads to AIDS, acquired immune deficiency syndrome, the final stage of HIV infection. HIV belongs to a group of retroviruses called lentiviruses. The genome of retroviruses is made up of RNA, and each virus has two single chains of RNA for replication. The virus needs a host cell, and the RNA must first be transcribed into DNA, which is done by the enzyme reverse transcriptase. The structure of HIV. The viral core contains the viral capsule protein P24, which surrounds two single strands of HIV RNA and the enzymes needed for HIV replication, such as reverse transcriptase, protease, ribonuclease, and integrase. Out of the 9 viruses genes, there are 3, namely GAG, POL, and ENV, that contain the information needed to make structural proteins for new virus particles. The mature virus consists of a bar-shaped electron-dense core containing the viral genome, 2 short strands of RNA, about 9,200 nucleotide bases long, along with the enzymes reverse transcriptase, protease, ribonuclease, and integrase, all encased in an outer lipid envelope with 72 surface projections containing an antigen GP120 that aids in the binding of the virus to the target cells with CD4 receptors. By electron microscopy, the plasma membrane of an infected CD4 exhibits budding virus particles, approximately 90 to 100 nanometers in diameter. Like other viruses, HIV does not have a cell wall or a nucleus. HIV treatment. Not all HIV-infected people progress to AIDS. With proper treatment, antiretroviral therapy, ART, you can keep the level of HIV virus in your body at a low. ART was introduced in the mid-1990s. Before then, people would advance from HIV to AIDS within a few years. Now, people who treat the virus in time can live a normal life expectancy. But there's still no cure for HIV currently. Standard antiretroviral therapy consists of the combination of at least 3 antiretroviral drugs to maximally suppress the HIV virus and stop the progression of HIV disease. Huge reductions have been seen in rates of death and suffering when use is made of a potent ARV regimen, particularly in early stages of the disease. Since 2013, WHO has recommended the ARV used for the prevention of HIV infections, particularly for pregnant women, young children, and key populations exposed to HIV risk. HIV transmission. Only certain fluids, blood, semen, pre-seminal fluid, rectal fluids, vaginal fluids, and breast milk from an HIV-infected person can transmit HIV. These fluids must come in contact with a mucous membrane or damaged tissue to be directly injected into the bloodstream from a needle or a syringe for transmission to possibly occur. The mucous membranes can be found inside the rectum, the vagina, the opening of the penis, and the mouth. HIV symptoms. There are 3 stages to HIV: early stage, clinical latency stage, and progression to AIDS stage. In the early stage, a few symptoms may include fever, swollen glands, sore throat, rash, fatigue, muscle and joint aches and pains, and headaches. After the early stage of HIV infection, the disease moves into a stage called the clinical latency stage. Latency means a period where a virus is living or developing in a person without producing symptoms. During the clinical latency stage, people who are infected with HIV experience no HIV-related symptoms, or only mild ones. This stage is sometimes called a symptomatic HIV infection or chronic HIV infection. During the clinical latency stage, the HIV virus reproduces at very low levels, although it is still active. If you take antiretroviral therapy, you may live with clinical latencies for several decades because treatment helps keep the virus in check. For people who are not an ART, this clinical latency stage lasts on average of 10 years, but some people may progress through this phase faster. If you have HIV and you are not taking HIV medications, eventually the HIV virus will weaken your body's immune system, which goes into the progression to AIDS stage. The onset of symptoms signals the transition from the clinical latent stage to AIDS. During this late stage of HIV infection, people infected with HIV may have the following symptoms: rapid weight loss, reoccurring fever or profuse night sweats, extreme and unexplained tiredness, prolonged swelling of the lymph glands in the armpits, groin, or neck, diarrhea that lasts for more than 1 week, sores of the mouth, anus, or genitals, pneumonia, red, brown, pink, or purple splotches on or under the skin or inside the mouth, nose, or eyelids, memory loss, depression, and other neurologic disorders. Many of the severe symptoms and illness of HIV diseases come from the opportunistic infections that occur because your body's immune system has been damaged. Cuba is a Caribbean island located 150 kilometers south of Miami. It has a population of over 11 million people. The capital city is Havana, which is located on the northern coast of Cuba. Cuba is a communist state. The Caribbean is the second most affected region of the world in terms of HIV prevalence rates. Based on 2009 data, about 1% of the adult population, about 240,000 people, is living with a disease. The current HIV adult prevalence rate in Cuba is estimated to be about 0.07%, one of the lowest in the world and certainly the lowest in the region. A few reasons why Cuba has maintained this low rate is because Cuba provides free universal health care, teaches sex education in their school system, traces possible sexual partners of those infected by HIV, and demands mandatory HIV testing. Cuba's national AIDS program is the most successful in the world based solely on statistics, and this country also has what many believers is the most interesting program in the world. Cuba took drastic actions in public health even before AIDS had reached the country. On the advice of Dr. Jorge Perez, the country's leading infectious disease specialist, the government set up a National AIDS Commission in 1983 and destroyed all foreign-derived blood products. Although this action put a strain on the country's blood supply and enabled Cuba to escape transmission of HIV through blood transfusions. As soon as AIDS reached Cuba, the Cuban government, through the Ministry of Public Health, designed and implemented a national government aimed at controlling the spread of disease. Cuba's strategy differed enormously from other nations and was illegally found in already existing regulations to protect citizens' health. Regulations included Decree Law 54 of April 1982, stating that for the exercise of prevention and control actions for transmittable diseases, one or more of the following measures will be adopted, depending on the case: isolation of individuals suspected of suffering from an infectious disease and of possible carriers of the causal germ, if necessary, as well as the suspension or limitation of these individuals' activities when their realization poses a risk for the health of others. Furthermore, Law 41 of July 1983 on public health, whose Article 20 referred to diseases that might become epidemics, stated that the Ministry of Public Health will determine which disease pose a risk for the community, will adopt diagnostic and preventative measures, and will establish methods and procedures for mandatory treatment. These regulations led to the lawful creation of the Santiago de la Vegas AIDS Hospital in Havana for HIV positive individuals. Similar hospitals were created in other areas of Cuba. So from 1986, when the first case of HIV appeared on the island, to 1994, the Cuban government quarantined all people found to be HIV infected. In the hospital, patients learned about HIV and AIDS, how the disease is transmitted, how a person can prevent transmission to others, and safe sex practices. Food, housing, medications, social services, privacy, and other services are provided in the hospital, as well as the intense education and prevention program. In 1994, required quarantine were relaxed, but all new people who tested positive for HIV still have to go to the hospital for 8 weeks of thorough education on the disease. After the education program, patients are allowed to stay in the hospital. Many stay because of the free service and good care, but they are also permitted to return to their communities, families, and jobs while making regular outpatient visits to their physician. All HIV-positive citizens in Cuba also receive antiretroviral drugs manufactured in Cuba. Cuba began manufacturing generic antiretrovirals in 2001 for all the country's AIDS patients. Besides mandatory educational treatment in the hospital, Cuba requires several other HIV/AIDS regulations. All pregnant women must undergo an HIV test. If found to be HIV positive, mothers are given antiretroviral drugs to prevent transmission to newborns, and also must deliver via C-section, which is known to reduce HIV transmission. HIV-infected people must provide the names of all sexual partners in the past 6 months, and those individuals must be tested for HIV. People found to have any sexual transmitted disease must undergo an HIV test as well. Voluntary HIV screening is encouraged.